Well, welcome everybody to our second virtual Ready Carlsbad Business Alliance meeting. My name is Carolina Alban Stoughton and I'm the Chamber Liaison for this committee. Thank you so much. We have really good agenda for today as always. And before we get any further, let me just start with David Harrison once again from the City of Carlsbad, the Assistant Director for Emergency Operations. Welcome, David, and give us an update of what's going on.
Do I have a few minutes to share some slides?
Yes.
Okay. Let me see if I can pull them up. Can everyone see this graph?
Yes.
Okay. So this graph summarizes the trajectory of our rate of COVID-19 cases in the city of Carlsbad as a percentage of population. This particular slide normalizes it over 50,000 population. Other statistics normalize it over 100%, but it's a little bit more representative than just showing total numbers, which can vary by jurisdiction and their populations. So the white line is the city of Carlsbad, and you can see, as you remember, that back in March, the city of Carlsbad was really kind of in the surprising position of being the third or fourth highest city with COVID-19 cases when this outbreak started. This outbreak of community spread started, and there's probably some explanations for that. But over the course of the weeks, as actions were taken, and perhaps due to some other non-action related, let's call them natural causes, the line started to flatten, and there's been an awful lot of discussion about the importance of flattening this curve so that we didn't exceed our healthcare capacity, particularly our ICU capacity to treat those that were infected by COVID-19. So just briefly, not spend a whole lot of time on this slide, you can see that over the course of the weeks that Carlsbad's rate of infection has leveled off, and we have actually dropped from that third or fourth position with the most cases in the county to a position where only one other jurisdiction has fewer cases per 50,000 than the city of Carlsbad, and that's our neighbor to the east, San Marcos. You can see, if you look at the other jurisdictions in this slide, that North County jurisdictions, comparatively speaking, are faring fairly well in the flattening of the curve. Those higher density and higher population cities are still having more challenges, and you can see which jurisdictions those are. We've also superimposed on this graph some of the major actions taken. I'm sorry, can everyone hear me? Okay, I heard some noise in the background. I was just saying, you can see superimposed on the graph for some of the more prominent actions that have been taken by government over the past number of weeks, starting with the issuing of guidance to wear face masks and the closure of parks and beaches, and then moving on into May, they start to reopen some of those. So if there's any questions on the slide, maybe we can hold them to the end. I wanted to move through and not to take a whole lot of time from our principal speakers this morning, but there had been some questions about reopening, so I wanted to get to that very, very briefly. We still are operating under a county health order. This is just a screenshot of the first page of this county health order, but it's just a reminder that our actions in our jurisdictions are under the direction of the county public health order, and this is just an example of the health order, and it imposes constraints on our behaviors, certainly our social distancing, and what can be open and what can be closed, and we as a city comply with these orders. This was one of the graphs that the county had been using most recently, and will probably continue to use. In that top jagged trend line, which is slightly trending to the right, down to the lower right, was one of the principal indicators we were using to evaluate the health of our response to COVID-19, how well we were doing. And We want to see figures below 6% on the vertical right-hand column. You can see percentages ranging from 1 to 9%. And the line is in the neighborhood of 6%. It's been trending down from 8 or 9 a number of weeks ago down to 6. And this is a percentage of the number of positive cases as a percentage of the total test cases being conducted to determine infections of COVID-19. So over the weeks, we've been, the county public health has been administering more and more cases. As you administer more cases, you'd expect perhaps the numbers to rise. But if we are starting to control the spread of the virus in our community, the number of new cases as a percentage of total tests being administered should begin to drop. And we hope to see it continue to reduce into the 5 and 4 and perhaps lower percentage rates over succeeding weeks. So this was one of the measures the county was using to assess how well we were doing. I'm going to skip over this slide that just talks once again about total cases and hospital bed availability. Weeks ago, there's a lot of talk about a spike and trying to smooth the curve so we didn't exceed our hospital capacity. That is less of a risk. It's less of a real concern right now. This last slide just shows a total number of positive cases. It assumes a recovery rate. It talks about the number hospitalized at just under 1,900 and some, those in ICU and those in death rates. All of these are, although very, very fortunate, are well within our regional hospital capability. Yesterday, the governor mentioned that we would be moving into stage 2 in his 4-stage reopening plan. And so he provided, his staff provided a number of slides to explain what stage 2 is and what it implies for the state. It's not a return to normal. COVID-19 it's recognized, it's still spreading, but we are in a position where we can gradually reopen certain activities and businesses. So starting today, the governor has authorized, and of course our actions here in San Diego County are really driven by our San Diego County Public Health Officer's health order that I showed you earlier. But the door is open, if you will, for retailers to do additional activities, and that includes certain segments of the retail space that can provide pickup and delivery services. And the governor also mentioned examples of those in the retail space as bookstores and jewelry stores and toy stores and clothing stores and shoe stores and furnishing stores, sporting goods, antiques, music, and florists. And similarly, there's some guidance for manufacturers and logistics wholesale folks. And the governor said as we continue to move into stage 2, we can gradually reopen more industries, and there's a practice for doing so. And I'll talk about that just briefly in a future slide. And he also opened the door for later, as we continue to improve our environment, that offices, restrictions on offices can be started to be lifted, and perhaps dining at restaurants, in restaurant dining, once certain practices and procedures are in place. This is all something to look forward to, and it's not immediately happening now. But what all business sectors should be considering now is performing a detailed risk assessment. They should be training their employees on, excuse me, social distancing practices and other hygiene, respiratory hygiene practices, and developing and implementing site-specific plans. The governor also mentioned that there was a provision that certain counties can move ahead of his framework if they can attest to certain conditions. And he spelled out what those conditions were. The most restrictive condition is under epidemiology stability, and it's check number 2 that says no COVID-19 death in the past 14 days. This is going to be a hard criteria to meet for counties with significant populations. And it's going to be hard for San Diego to meet. So as I said earlier in the presentation, we showed some slides and statistics. I have a feeling that this will become the principal tracking statistic in the days to come. And we all look forward to the day when we have no COVID-19 deaths for 14 days. Right now, we're hoping to have no new COVID-19 cases in the past 14 days, and that's still on the horizon away. But at any rate, there is hope. We will get there eventually. And that was the last one. So this is just the website where the governor has put out the roadmap for proceeding through the stages, through stage 2 and stage 3. All of this is being interpreted by the county health officer. We expect a new health order to come out later today to reflect some of these changes that the San Diego County is incorporating. The governor also mentioned that checklist is associated with his framework. And we will, as the city of Carlsbad, will be posting all of this information on our webpage. So I appreciate your attention. I'm happy to answer your questions, but I wanted to turn it back over to Carolina.
Myself. Thank you, David. Thank you so much. As we wait for David to join, we actually do have a question from Josh. And Josh, if you want to unmute yourself and ask it directly, feel free. Let me unmute you.
Yes, I'm just wondering, as we're getting more tests, do you know if the total number of tests taken reflect a one-to-one relationship? For example, if there's a patient that has multiple tests, is that being considered a single test? Or could you have a single patient that has 5 potential tests over the course of 2 weeks and it's showing as 5 tests in our results, even though it's a single case?
Let me give you my understanding. And so I'm going to caution it. I'm not working public health or epidemiology, but I think they're counting 2 separate things. They're counting the tests administered. So if a single person was getting multiple tests, that would show up as testing in the testing numbers. But obviously, they're probably only counting a single positive case per person.
Okay. And at the beginning of this, you had mentioned the importance when China was breaking about recovered cases. Yeah. Is there any discussion at all from what you've heard in the EOC or with county officials as to whether or not they're tracking recovered cases? It seems like that's not proportionate to what we're seeing versus active.
They referring to County of San Diego?
Yeah.
Okay. Yes, they're talking about it and they are tracking it. I'm going to say it's probably not their priority focus right now, but they are tracking it. You saw it on that one statistical slide in a, if I recall the color correctly, a green line that was increasing and kind of chasing the number of cases line. But that is not a statistic that shows an individual has, for example, been tested twice and been negative twice, which used to be the standard for ensuring they were clear of the virus. Okay. It's more a projection, kind of an extrapolation from 14 days from the initial exposure of the virus.
Wonderful. Thank you so much, David. And I know David Harrison has to leave here, of course, probably one of the busiest people here in town, but if you have any other questions, we'll make sure to email that to David, and then we can, I can send a mass email with that particular question. So if there's are no more questions, I know, David, you can stick around for just a little bit more, but when you gotta leave, that's totally fine. So we're gonna now hear from the Chief Innovation Officer for the City of Carlsbad, David Graham. And let me just make sure, David, that I have, oh, okay, you are ready to go. Perfect. Well, thank you so much, David, for joining us once again. I know it's been a very, very busy week for you in particular, with this new loan for small businesses being approved by the City of Carlsbad. So we thank you for taking the time to join us.
Oh, it's my pleasure to be here with you. And just want to start by saying, thanks as always to David and the partnership here. We've been scrambling with the orders that have been coming down, all week, hearing from the state regarding what can open, what can't open, but waiting for further guidance and clarification from the county, which, as of 12 a.m. this morning, there was some additional clarity there We continue to do our joint communications. So you'll see one today coming out, which is basically the Chamber, the CVA, and then everyone with a business license and those who have asked to be on our list get joint communications regarding what's going on with the state, with the county, and really our economic recovery and revitalization efforts. So I'm not going to spend a lot of time on that unless there are questions, but we're fielding every day 60 or more emails, calls, questions about what can open, what can't open, what sort of resources are out there. I will say good news on the federal assistance programs, the Triple P program and EIDL. We are hearing more and more that people are getting approved, people are getting funded. Now, obviously, not everybody is, and depending upon what program people have applied for, there is still challenges, but we are hearing more folks getting funded, which is great news. The other thing I would mention on that front is we have gotten some recent information that for the Economic Injury and Disaster Loan Program that the SBA is administering, that those funds now are primarily going towards agriculture, and less are being approved for other business types. They're really trying to shift folks into the Triple P program as much as possible. So if you have applied for an EIDL loan, we hope you're able to get funded, but on a go-forward basis, our expectation is that it's likely less and less of those will go to businesses that are not agricultural. Additionally, I'm going to share my screen right now. On Tuesday night, the City Council continued with its economic recovery and revitalization efforts, and I'll share with you some of the slides that we shared that evening. So I'm going to go here. Just about a quick update. The City Council had created an ad hoc economic revitalization subcommittee, as many of you know. They've now held 5 meetings, presented 2 sets of recommendations to the City Council, and as of Tuesday night, the program was funded with $5 million. We've also continued, and thanks so much to the Chamber for being a part of this. The Chamber, CVA, and many of our businesses were instrumental in designing this program and providing feedback to the Council, to the Economic Revitalization Subcommittee. I really want to thank Brett and Christine for the work there, as well as many of you in the business community who provided a lot of information, either through surveys, through our live webinars and polling, through one-on-one contacts on things that would really help your business during this really difficult time. So the City Council approved $5 million, with 88% of that going towards a business loan program, which I'll talk about in a second. They did reserve for additional future council decisions about $250,000, although that would go into the business loan program if unexpended. An initial funding amount of $250,000 to develop a joint marketing and business promotion strategy. And we're working together with Visit Carlsbad, the Chamber, the CVA, and others in the tourism and hospitality sector and small business sector to develop that strategy. We're also working to partner on mediation and renegotiation services. And then we do have a few city lessees who need some deferral of rent, and so there's funding for that. I'm going to move on to the fact that when we look at business loan programs specifically, some cities have decided to move forward, others have not. The County of San Diego is in the middle of developing a program, but for our neighbors, Oceanside, San Marcos, Poway are those that have programs that range up to $50,000 as a max loan amount, with varying terms, but all very competitive interest rates, in some cases 0% interest rates. So a few things for the 2 different programs that were approved by the City Council. One, obviously, you have to demonstrate economic impact due to COVID-19. The consensus is it should focus on small businesses. One must have a valid business license as of March 1st, be in good standing with the city, so current with all city fees, no outstanding litigation, code enforcement violations, and the like. And if you participate, have participated in the Triple P or EIDL, you are still eligible to apply for the city program, but you can't effectively double dip, use the funds for the same costs that you were using Triple P or EIDL. And we're also looking to award to those who did not receive Triple P or EIDL. Now, I will say it's really, really important that those two federal programs are the best opportunities to support businesses given the size, given the scope, and given the forgivability of those loans. So if you haven't applied for them and feel that that is appropriate, that is really where we're continuing to move people to, because the size and scope is just so much larger than anything the city could do, and the forgivability of it is really helpful and useful. I do want to note here that in the CARES Act, there was funding for helping cities of 500,000 people or more. Well, guess what? Those who do not have 500,000 people or more are not getting effectively any support from any of the federal stimulus programs. So there's no backfilling. And at the same time, our tax revenues are being hit very hard. The deferrals that are out there on payments of sales tax, TOT, et cetera, those have a direct impact on our bottom line. And as opposed to in our region, the County of San Diego and the City of San Diego receiving funding from the CARES Act, the City of Carlsbad effectively has gotten almost zero. There's a small amount for CDBG, but that's why it is so important that businesses really rely on, if they are going to be applying for a program, really try first to apply for the Triple P and EIDL. So the first of the two offerings in the loan program are small business microloans for businesses with $2 million or less in gross revenue or 15 or fewer employees. This loan amount is between $5,000 to $10,000. The first payment can be deferred for up to 90 days, and you'll see the scaling interest rates there depending upon when the loan can be paid back. Now, this is approximately 2,700 businesses in the city of Carlsbad. The initial funding for this is 1.5 million of that 4.4, which would result in approximately 150 to 300 loans, and eligible expenses would be for rent, payroll, mortgage interest, utilities. On this particular offering, we do recognize that that amount is not incredibly high, and so this really is for the very small businesses. We do want to take an agile approach to the design of the programs. So I'll talk about this in a second, but we have based the design of these programs on our engagement with the business community. This should not be an approach where this is really everything to help a business get by. This is supposed to help complement the other efforts that our businesses are doing to try to continue operating. The second are small business recovery loans. So here, gross revenue of 3 million or less, and or 50 or fewer employees. Here, the loan amounts are $10,000 to $25,000. Again, the first payment could be deferred for 90 days, with a payback of 2% within 12 months, 3% within 30 months. Here, the initial funding tranche would be $2 million. Again, the same eligible expenses. I want to mention, where do we come up with the interest rates for this? Well, first, we are looking to be competitive with things like the EIDL program, which is a 3.75% interest rate. At the same time, the city has a responsibility to the taxpayers. So when we look at the forgivability of things like the Triple P, it was determined that this couldn't really be a grant, but that we wanted to be extremely competitive on terms. And so with the city's investment portfolio, so effectively what the rate of return the city would be receiving on this money anyway would be, right now sits anywhere between about 1.5 to about 2.2%. So that's why we're pegging most of this at that 0%, 1%, 2%, which is about what the city would otherwise be earning. And for those that are below that rate, that's why we have the 3% payback within 30 months. Still very competitive, but helps to round out the program. So the city is effectively, although deploying significant resources, we're being very responsible to the taxpayers through all of this. So when you begin to measure up how this program would look compared to the others, it is really kind of right in the sweet spot here, with, in some cases, more competitive and higher amounts on terms. In other cases, able to deploy more resources to more businesses than some of the other programs. And note that doing some quick math, $3.5 million doesn't equal 4.4, right? Well, the two things that we're working with there are continuing to work with the business community on whether there is another loan program that would make sense. So longer terms, higher caps, industry focus, those sorts of things. Two, if you can look at the estimated number of loans the city would be providing, which is between 230 and 500, depending upon the average loan size, that is a lot of activity that we do not have the staffing for. And so we're looking to partner with a lending organization. I've been on the phone all week and last week as well. And so we will be partnering with a lending organization to deploy these resources in conjunction with the city. That effectively has an administrative cost to it. And so effectively the remaining amount of the 4.4 will go to a couple of places. One, it will go in some portion to administration. Two, it will go to, if there is an additional program that through our engagement we believe makes a lot of sense, it will go towards that. Or three, and probably the most likely, it will go to a second tranche on the first two loan programs that were provided. Very important, and there was clear messages from some of the council members that any of the resources that are not deployed in this initiative will not go back to the city's economic uncertainty set aside in the general fund, which I'll touch on in a second. It would go towards continuing to push those resources to support economic recovery and revitalization. How are we funding all of this? Well, the city has been very prudent and has over years set aside an economic uncertainty set aside. $3 million of that is going directly towards COVID-related expenditures. $5 million of that is going towards economic recovery and support. But even with that, there's still approximately $11 million in that set aside, which was designed specifically for events just like this. And as far as a few quick timelines, so I'm going to stop the share here. We're intending to have secured a lending partner by May 15th. We're going to run a webinar regarding the web program or the loan program the week of May 18th. And then our goal is to have a portal and applications go live the week of May 25th. With that, I will pause and see if there are any questions. But again, really want to thank those of you who helped support this, provide information, and I think that for the region, and I would say even in the state, it's a very competitive program and an approach that allows us not to be locked in, but also be able to deploy resources while being very responsible with public funds. The reason and rationale ultimately for this is that there is a public benefit to supporting our local businesses, whether that be continued employment of our residents, whether that be continued revenue back into the city because businesses can continue to operate as opposed to closing their doors permanently, whether that be really the cycle of the services that are provided to our residents. There is a direct public benefit, which is the rationale for putting these resources towards supporting the economy.
Thank you so much, David. I just have one question, and if there is somebody interested in becoming a lending partner for this program, is the city going to put out not an RFP, but some sort of like contest of information for people to apply to be evaluated for that, or is it just whomever hears about it can just consult with you guys? What is the process?
So, I mean, we're first really looking to those with, we're frankly looking to those that are nonprofit and not-for-profit lending partners that are local, first and foremost, that have experience in small business lending. And so those are who we've reached out to first. We have had folks that have reached out to us, and we're evaluating everybody that comes. This is a balance of moving things forward quickly.
Yeah.
And so we do, fortunately, in our region, have very strong organizations that do this on a regular basis. But we are open to any other lending partner that would be interested. We're not looking to have multiple partners because that's just doubling or tripling your overhead. So anyone that's interested can email business@carlsbadca.gov.
Awesome.
I have a question. This is Leila Panagitis. Thank you for your presentation. I wholeheartedly agree with your last statements there about the business community. This morning, the Department of Labor put out some staggering numbers on the job losses across this country. Nothing that we've seen since the Great Depression. How many job losses have we seen in Carlsbad? How many companies have submitted warn letters, and how many companies are not coming back after this, or have already declared they're shutting their doors permanently?
Yeah, a really good question, and one we get asked from council, and one that we're always trying to evaluate. So a couple of things. One, the data trickles down, right? So the feds basically have data regarding national statistics, then the county does its work. Right now, we really only know at the county level, and Sandag, if you guys have seen that, has put out information about what our regional impacts are or estimated impacts. I will say that the warn notices, and for those of you who don't know, there is a requirement for businesses of a certain size to notify the county and the city when they are doing significant layoffs. Of that, right now in Carlsbad, there's about 36 businesses across multiple sectors, but primarily retail, hospitality, restaurants that have provided warn notices to us. They represent about 5,000 layoffs. Obviously, that's just a small percentage of the overall. We don't know exactly how many businesses have closed and closed permanently, but we do know, like, for example, on the restaurant side, we have about 129 that are a part of our GIS mapping that are open, but we know we have over 300 with licenses in Carlsbad. So if I were to, as we look at kind of the data, and it's tough to know who's permanently closed because we don't have, because of so many of the sectors being closed, but we kind of see it as a third, a third, a third. About a third are essential and continue to operate. About a third are probably going to be able to do modified opens and reopens, and then a third remain closed. We'll continue to, through surveys and other means, try to determine, how many have actually closed in the city of Carlsbad. But we're kind of hitting that tipping point about now, and so we'll provide that information to the chamber as we're able to get it.
Thank you.
Thank you. Thank you. Thank you so much, David. And of course, David has, if you guys go to the chat window, we have David's email right there. If you guys have any other questions, or if you remember later that you do have a question, feel free to email me and I will share this email again. Thank you so much, David, for all your hard work. And we are going to move to our topic of business continuity, and we have a wonderful guest speaker with us today, Fiona Raymond-Cox from Raymond-Cox Consulting. Fiona for after leading both Marsh & Price Waterhouse-Coopers business continuity practices in San Francisco and Hong Kong, respectively. Fiona founded Raymond-Cox Consulting in 2010, which is a San Francisco-based boutique business continuity and emergency planning consultant firm. So she has more than 20 years of international experience in process improvement and risk management solutions, analyzing business continuity management programs, performing risk assessments, designing, implementing, and exercising incident crisis management, business recovery, IT disaster recovery, and pandemic plans for small nonprofits to Fortune 100 companies. So we are so happy to have you, so pertinent for these conversations, since we are talking about global pandemic with massive impacts. So thank you so much, and I'll let you go.
Thank you, Carolina. And I put together a little presentation myself, so let me share my screen.
Yes.
So let me just get this so it looks a bit better.
Yeah.
Into presentation mode. Okay. All right, and this is specifically for you. And let me explain. My key in talking to you today is to really answer some of your questions. So I wanted to leave plenty of time to hear what you want to know. But first, let me just explain that Stephen Baruch and I go way back. I run this consulting practice, as Carolina said, but I also served up until January as the president of the Business Recovery Managers Association, which is a Bay Area centric organization focused on helping the business continuity, resiliency, and risk communities with education, really to educate our members. And I served in that role as president up until earlier this year. And it was interesting, the new president reached out to me with a question about, responding to the pandemic. And I realized that, wow, I think that there's a lot of people with a lot of questions. So stemming from that, I proposed that we start running some pop-up webinars. And about a week ago, I facilitated my 10th so far, and we've just scheduled a couple more in May. It was as a result of working with clients, both large and small, that got me thinking. It was a result of working with those clients and facilitating those pop-up webinars to address top-of-mind issues that other business continuity practitioners were facing, that got me thinking, people don't know how to open their business. And so that is why I ended up writing this COVID office reopening plan. And I think here are some of the things. I suspect the reason that you're all on today's call is that you are in business. Either you run your own company or you represent a company or a business, and that's why you're part of this network. And so one of the things that I think has been really hard for people to grapple with is this very first question. The idea is, as these public health orders begin to ease, the questions that are coming up have to be, why do I want to reopen? Why do I want to get back to business? Many organizations who built out their business continuity plans or have scrambled to build them out in response to the pandemic have been very successfully teleworking. So it really depends on what type of business you represent as to how you're going to answer why reopen your workplace. And it was designed really as an office reopening plan, but I'm going to get into some specific questions. I think the question is it, are you going to have the customers? Are customers going to come back to you, whether you are in a retail space or whether you are in in the technology world, it doesn't really matter. You've got to still be able to provide services, and have you been successfully being able to do that? So interestingly, today I saw that Google and Facebook are actually going to allow their employees to continue to work at their choice through from their work from home operations through the end of the year. And I suspect that we're going to see this more and more, that those that have been successful at implementing this work from home strategy will continue to do that, and they will start to allow some people to come back. And that may be because for whatever reason, their home situation doesn't really provide a very good setup for them to work from home. So I think the number one question is, why do you want to open up the workplace? And are you going to have customers that you're going to be able to fulfill? And if you determine that there's a valid reason to do so, it's then a question of, well, when do I want to start opening up the workplace? Because my workplace is going to look very, very different when we get to that, and we can talk about that in a minute. But these are questions that were coming up thick and fast, and I don't think there's nobody that's got the magic answer. It's going to have to be if you run a business, you're going to have to decide what is right for your business, your staff, your customers, to make it a safe environment in which to enter again. And so how are you going to do that? So these were sort of some of the questions that were coming up, and I think that it's really important that you factor these in. So what I did is I ended up developing this plan that I'm not sure if Stephen has made available to everybody, or Carolina will make it available to everybody after this call, but it is also on our website, so anyone can go and pull it down. I've tried to make it freely available to as many organizations and associations that I can think of, as well as clients. And it's not intended to be the answer to everything, but it's to really trigger in some discussion. And I think if you can't answer the question, then you've got a problem. So what we did is we've created 15 checklists to make you think about why would you open up, when, and then there's how to make this workplace safe to do so. And then there's a couple of forms at the back that you can customize to your needs. So I think once you've decided the triggers for re-entry, then you'll need to start looking at some of these protective measures that you're going to have to put in place. Let me tell you, I'm having a lot of conversations with clients right now, and the Burma members that I spoke about. And I actually did a little poll to find out what people are using to determine when they would open. And so here's the question. I have a client, for example, who just said they're a global organization, and what they've decided is that they will not even consider in the Bay Area, for example, reopening their headquarters to staff until the end of August, beginning of September. And their rationale for doing that is because they've got employees who have children at home, or they're caring for elderly, and they don't want to they don't want to expect people to come back who are still caring for their loved ones. And then others, when I did this benchmarking study, who are going to rely on the local public health officer to determine the appropriate time for their jurisdiction of when to open. And we heard from Governor Newsom yesterday and David Harrison this morning. There are some strict guidelines in place as to trends and cases that will drive the ability to open up in phase 2. And they're pretty stringent. There's no deaths in the last 14 days was a perfect example of that. So once you've got over once you've decided where you're going to pull your data points from to determine whether you should open, again, that's going to be unique to each business, but and it really does vary. Some businesses, as I said, taking guidance from the public health officer, while others are going to decide whether or are watching their own trends. They're analyzing the trends themselves, and they're going to make a determination not only on the number of cases and falling trend, declining trend numbers, but also looking at infection rates in the community, or some said that they're looking at hospitalization, bed capacity, and so forth. So they are not necessarily just taking the advice of the local public health officer, but they're doing additional research of their own to determine their triggers for re-entry. And then they're also doing things like putting together surveys for their employees to complete as to whether they even want to come back. So even if you say, I want to reopen, there's no one that I know that's not going to do it on a phased approach. And so that point of reopening is probably going to require the facilities people to prepare the site to the point where you can welcome back a few people, and you're going to have to allow for social distancing and so forth. And then different organizations will bring in, anything from 10% of their workforce to maybe up to 30% on a staggered basis. And whether that staggered basis is you establish a team A or a team B, and then a team A and a team B, and then whether you do it that team A will work the first 14 days and then team B will work the second 14 days, or whether you have team A coming in Monday, Wednesday, Friday of week 1 and Tuesday and Thursday of week 2. That's also, these are the discussions that organizations are having. But I think as you begin to think through how you're going to open, these 2 slides are obviously key to making some decisions. So are you going to monitor the health of your people as they come in? How would you do that? Are you going to do temperature taking, or are you going to do a sort of more on the honor system that you're going to have people take their own temperatures? Would you provide thermometers, things like that? How are you beefing up sanitization in the office, making sure it's clean, and that people will want to know, your staff are going to want to know that they're coming back into an environment that's that cares for its people, and it's so some people are cleaning multiple times a day, others are maybe giving their staff wipes to wipe down their desks in addition to deep cleaning. So there's definitely been an increase in janitorial services. This idea of scheduling, are you going to have a team A and B, or are you going to do different colors, and when are they going to come in? Are you going to have people on shifts? Those are things to think about. Do you have people that really have to come back in but are scared and they're really nervous of taking public transportation? There's a couple of things that are happening right now, as you probably are aware. Public transportation, I suspect down in the city of Carlsbad, has limited public transportation right now. It certainly is in the Bay Area. And so are you going to get people to drive to work? Are they going to take public transport like taxis, lifts, Ubers, and so forth? Are you going to give them a care package so that they've got a face mask and hand sanitizer? Are you providing that, or are they going to provide that? These are all the sorts of things that you need to start thinking about. when they get into the, get to the workplace, what are the expectations? If you have visitors, are they going to have to sign a health screening form, for example? Are you going to put up plexiglass at the reception area? So that's a high traffic spot. So you're going to have people thinking about having to stand up if you have to hand something off, but otherwise they're sort of more protected. Elevators has been a hot topic, believe it or not. So if you're in a high-rise building that has an elevator, how are you going to sort of social distance? How are you going to press the buttons? Once you're inside a building, how are you going to prevent or minimize the risk of more than, say, 4 people getting in an elevator, standing in the 4 corners, once you're trying to move between floors in a building? So office spaces, that social distancing, keeping people 6 feet apart and so forth. Many organizations are taking floor plans and literally marking up desks with, again, take that example of the A and the B team. This is the A team can sit here and the B team can sit there, and you never have them on site at the same time, or not while we're sort of slowly beginning to open up. Meeting rooms, that social distancing, many organizations are where they've got a system that they can limit the number of people into a conference room, are restricting the capacity, and doing more than that, they're actually removing tables and chairs just to enforce that social distancing. They're also perhaps organizing cleaning between meetings. And let me just say, the things that I'm talking about are really embedded in the checklists that are part of the plan that I've provided, but it just gives you, some food for thought. We didn't address in our plan that point of sales at stores. So if you run a business and you have a storefront and you're asking people to come in, you're going to have to look at how you social distance. And I think much of what applies to office spaces and meeting rooms and so forth are going to apply, but you've also got the added thoughts of how do you get people to sign, when they're paying, do you want to become cashless? All those sorts of things need to be given some consideration. Staff working shifts in the same room, clearly you're going to want to make sure that they're wearing their PPE. Everyone knows what that is now, face masks and so forth, but that they're cleaned. The space at which they're working is cleaned between one shift and the next. If you have an organization that has people that are working outdoors, clothing and footwear comes into play. If you have shower facilities and so on, again, are you even going to open them, the changing rooms and showers, or are you going to just cordon them off with caution tape or lock them so that becomes a room that they don't get into? All right, so similarly, lots more things to think about as visitors come into the premises. Are you going to, let them know that you've actually implemented a new approach to how you're going to receive them? Are you going to get them to sign a health declaration form? There's no handshaking and so forth. You really need to be thinking about, as people are entering, what are the expectations? How are you going to move people through? How are you going to deal with third parties? If they're delivering foods, for example, are you going to have them wait outside? Are you going to have people delivering at the loading dock and so forth? So here, basically, these are all things that I've included in the plan. I just want to make sure that, time is now 8:30. I want to give people an opportunity to ask some questions. Let me just say that once you go through these checklists and think about how you're going to work and manage these types of areas, what you also, I think, really need to factor in, and it's included in our plan, is as people start to come back to work, they need to know what they're coming back to. So I think a key element of that is putting in place an education and awareness program. What what are your expectations? If you're staggering their work hours, what is the office going to look like when they come back in? Are they going to sit, at particular desks? Have you closed off conference rooms or minimized the number of people in a conference room, for example? If you run a store, what's it going to look like? You need to let your staff know what they're coming back to. And part of it is to make sure that they're comfortable coming back in. You also, and I know this is a tough one for everyone to get their heads around because we're in this right now, but if you open up, you need to know how you're going to handle somebody who shows signs of being unwell. And I think that's, that comes back to normal day-to-day practice anyway, but I do think it's really important that you think about that in light of if they start to show signs or symptoms of COVID, and there's many. And then obviously you need to think that if there was an infection that in the workplace, you have a reinfection response plan in place. So for example, I take that one step further, that if the city of Carlsbad goes back to a stage 1, for example, restricts movement once more, you have to be prepared. And that's really tough. You've psychologically got staff on board to sort of begin to come back to work. You start working again, and 3 weeks later, there's a massive spike in cases, and you revert back to a previous stage. You're going to have to think about that. So I think, Q&A, questions and answers. Let me see if anyone has anything that they would like to ask. And I hope this is helpful.
Absolutely. Thank you so much. A lot to think about for sure. I just have a question regarding on-site modifications for workplaces. When you talk about the plexiglass and all the stuff that's going up that we've seen already in grocery stores and supermarkets. So one of the things that may come to mind first is those are investments that and it will take, will come from your budget. And so when budgets are tight as they are right now, when you consider those investments, what are you thinking? Are you thinking this is going to be a forever thing? I'm thinking people will be why am I going to put these if this is just going to be another 6 months,
Right. So great question. So actually, I don't think it's going to be only 6 months. I think, we look back at past pandemics, and they have a sort of life cycle of 18 months to 2 years. And we can expect, Anthony Fauci even said that there will be spikes. Now, how those, or waves, and the way that some people did some modeling I was looking at recently, and 3 different scenarios, and these waves of pandemic will vary from area to area, country to country. They may be spiking in others, they may be more of a gentle curve, but there will be continual cases. There will be increasing numbers. So I think until a vaccine comes out, and then it takes time to get the population vaccinated, this is kind of going to be the new normal. You as a business, so I know you don't want to spend money where you don't need to. So I think you just have to look at the protocols that you're going to put in place. So if you're not going to put up plexiglass, which may be not practical, for example, then you really need to look at, if I'm at reception, for example, that's a high traffic area in an office, typically. How am I going to protect my receptionists from the people that are, coming into my site? And I think if, there'll be a lot of companies that do not take that plexiglass approach. I'm just giving you an example of something that many are beginning to think about and perhaps implement. So, would you, if you have a health screening form that your visitors have to sign, will you do that? For example, do you have the infrastructure, the technology set up to do that prior to them coming in, so that they could do it as an automated check-in effectively, so that when they show up, they give their, you ask them to stand back X number of feet, they give their name, and you check that they signed, the disclaimer or the health declaration form before they move forward into the office space, for example.
Wonderful. And our president and CEO, Brett Schanzenbach, is.
You went mute, Carolina.
Sorry, I'm saying Brett is always in touch with many, many businesses, and we also have an office. So he has a question for you.
Good.
Yeah, Fiona, thank you for a very thoughtful presentation and a great resource guide you put together. And we would love to share that with our members if that's appropriate. But
absolutely. Yep.
One of the questions that we're getting from our members as we start to look at people coming back to work is the issue of taking temperatures of employees upon entering the workplace. And excuse me, some employers would like to do that because of protecting fellow employers and also protecting any customers that they might come in contact with, just to make sure that people aren't coming to work with a fever. But we're also hearing folks on the legal side saying, well, because of HIPAA things, you can't do that. So I'm just curious what your conversations have been on this side.
Yeah. So let me just, I have to take you back to my days of living in Hong Kong. I was there during SARS. I was helping clients through that time. And ever since, I have, yes, this issue around temperature taking to me is so odd. Whenever anyone goes into Hong Kong, they're probably unaware, but there are these infrared terminals, cameras checking temperatures as you enter, and I think people just aren't aware that in Asia, this happens everywhere. In fact, I ended up going down to a client site during their mission critical business, and so they were open, and I had my own temperature taking going in. Doesn't bother me, but I know that there are many lawyers who are very concerned about this. I think at this point, it's going to be that with the public health orders, I think that there will be some, personally, I think that there will be some allowance to take temperatures. The expectation is that even the public health officers are saying, take temperatures. So I think you'll be able to hang your hat on that. I'm not a lawyer, but I think that that's where I would point people to. But there are many who are super concerned about this. And so the other way they're doing it is that they are using an application, like a mobile app, for staff to be able to record and say that they are symptom-free, that they have not been in contact with somebody, knowingly in contact with somebody in the last 14 days that has had symptoms or had coronavirus. And so they are using that. And then working with other clients who actually don't want to put the onus on the employees to self-declare, but are going to take temperatures. That's going to be a prerequisite. So if you have a problem coming into the site because we're going to take your temperature, let's talk, and maybe you're not going to be in that first or second phase of reopening. Does that help answer the question, Brett?
Yeah, absolutely.
It's a really tough one. I do have as one of the checklists, it's called temperature and other screening. Take a look at that and see if that just sort of triggers questions. The idea is that when using the plan, that either you're going to do what we've suggested, or you're not going to do it, or it's not applicable to your site, or there's a column where you can specifically type in what you know, as an organization, what you would do. And each organization, each management team will probably take a very different approach. And that's the intention. It's not so prescriptive. It's a tool to help you, your organization, decide what's appropriate for you.
Yeah, thank you for that answer. That's very helpful. And I do think, because I'm aware that the other countries have, you know, taken that approach much more proactively than maybe we in America are used to or, you know, comfortable with. But I agree with you that I think with the health orders out there that there'll be more latitude in being able to utilize that tool. So thank you for sharing that.
Yeah, no problem. Anybody else?
Yeah, Lila, go ahead and ask your question. We have one question from Lila, another from Sarah. Sarah, after Lila, you feel free to ask yours.
Hi, Fiona. I was talking to a colleague of mine in Texas that has reopened and requiring people to come back to work, whether they like it or not, but with very, very few exceptions. I know California labor law is different. You said it was, and I think it was very important, how do we make people feel comfortable to go to work? I think that extends to businesses as well, airline travel, all of that. And people will be cautious. Some people will be making very deliberate decisions on where they patronize businesses. But how can companies make people feel comfortable coming back to work? What can companies do to encourage people, in addition to some of the things that you already talked about in your checklist?
Yeah, I do think that it's being respectful that this is this is a tough time, and that we're trying to make the workplace as safe as we possibly can, and explaining the measures that you've put in place and the expectations that, you know, if you're going to expect people to keep a 6-foot distance, how's that going to work? Are you going to allow them to congregate in the you know, in the break rooms, or you know, what is the expectations? If they've got to come back, you want to be sure that you are communicating that you are providing the safest possible environment in which they need to come back into.
Right.
And
for those who have children, that's going to be difficult if the schools aren't open or if they can't find childcare, right?
Right. And so
providing childcare might be a solution to that.
Right. So yeah, I think at the moment, you know, we're still in that early phase. You know, I don't know whether Texas has now lifted restrictions on childcare, but you know, you're going to there'll be a large number of the workforce who you just simply can't get back, because if they don't have that that care that they need for their children. And that's why it's been so tough for, you know, the workers who are working and they're juggling their kids. It's just been a super challenge. But yes, you need you're going to need some infrastructure in place, whether that's at the local, the family level, or whether it's a business, to be able to open up. I mean, that's true. And then I'm trying to think, I don't know anybody, you know, I've got clients that have childcare, like daycare facilities on site. I mean, but those companies, I mean, they're not even, they're thinking much more long term. I suspect we'll see many more companies, particularly in the tech space, like the Googles and Facebooks today, saying that they're going to allow their staff, you know, they're looking at end of year. So, I mean, the key is to get people back into an environment where, you know, are you going to put up decals that mark out the routes that people should take? So, you know, are you going to close, you know, basically social distance in the restrooms, where you close off a sink or a stall or whatever, just to, again, put that separation. All of that, and communicating what you're going to do, is, I think is just key to all of this.
Yeah, great. Thank you.
Thank you. And we have one last question, so we can move on to Brett. We have one question from Sarah. Sarah, you there? Perfect.
I'll make this quick. One is that based on what you were just saying, I've already been speaking to each of my employees individually to get kind of noticing where they're progressing and how they're seeing it, what would make them comfortable as we're trying to figure all this out. So it's nice as an owner to have a pulse, but the other thing I'm wondering is, as a business owner, is it possible, and what are the discussions about a business being held responsible, and I mean legally, if somebody is sick and gets sick after they have returned to work, even though we may not be able to track that that's where it happened, but with these precautions, and this is unprecedented obviously, but what's the discussion about liability?
Yeah, so I'm not a lawyer, and I think that's a question that a lot of people are having right now. My sense is, again, a bit like Brett's conversation, if you can demonstrate that you've taken all precautions you possibly could, that you've provided a safe environment for them to come back into, you've done that health screening, you got them, did a health declaration form, they said that they were fine. I honestly, I am not sure, and I don't want to answer a question and give some guidance that isn't in my realm of legal expertise or anything, but I do think that you're going to have proven that you took every precaution possible. That would be my sense. In fact, it's a very good question, and it's actually a question where I was on a board call yesterday for this business association, and one of the things that we want to do is have a lawyer present to our members on this topic, because I think that's going to be the direction that many people will be very concerned about.
Colin had a great response in the chat if people want to look at that. Thank you.
So one thing I would say is, if you haven't already, at this point, we're 7 or 8 weeks in now, Mondays to Sundays, it all feels the same, most organizations, if they haven't already done so, have a pandemic task force that are going through and basically asking themselves many of the questions again that were outlined in the plan. And if you have questions, you can email me. But just, if I know probably want to move on, but the plan is available on the website. If you just click on the COVID-19 Office Reopening Plan tab at the top, you'll be able to pull it down from there as well. So, Carolina, I think I spoke a lot.
You know what? I was just thinking that we've provided so much information to our businesses from the very beginning, and Brett can talk more about that. But this has been a different perspective, and I feel like, in a way, the missing piece of the puzzle and all the content that we've put in together, because we hear a lot about the regulations and the ordinances and the public orders and all that, but I think this is like a very good guidelines for soul searching within the company, your culture and your brand and your goals. So thank you so much, and we'll be sharing obviously the recorded webinar with the people who attended and beyond, the ones who couldn't attend. And thank you for leaving your contact information available for us if we have any further questions.
Yeah, no problem.
Thank you so much, Fiona.
I think I'll leave you now unless you need me for anything.
No, that's yeah, you feel free to keep on with your day. We appreciate your time for sure.
Thank you so much, and nice to meet everybody virtually.
Thank you so much, Fiona. All right.
Bye.
So we are gonna go now with Brett, here, our president and CEO, who has also made some time out of his busy schedule to join us here and just give us an update of where we're at right now.
Well, good morning, everybody. Thanks for being part of the call today. And that was a great presentation by Fiona, very thought-provoking. And it was great because this phase that we're in is a new and very challenging phase. And it's two parts. It's the waiting game and the preparation game. And I think she talked very well about the preparation side. And, you know, we have some resources that our county has given us that businesses are required to fill out. They're not required to submit them back to the county, but they are required to fill them out and post them and share them about how they are planning to reopen. There's a 3-page PDF document that we have linked on our COVID page on the Chamber's website, and I'm sure you can find many other places if you don't already have it. But all businesses are required to put that together. And it covers some of the areas that Fiona covered today, although her presentation, I think, is much more robust. And I hope, Carolina, we get a copy of that, guide that she referenced several times, because I would love to make that available to our members. But and I really appreciate, I failed to mention, I don't know if he's still on the call, but David Graham, really appreciate his presentation today. And not just his presentation, but all his hard work in putting together the resources and the small business loan program for the city of Carlsbad. So David Graham mentioned that, you know, we're hearing more businesses that are being a little more successful in terms of getting PPP loans and the emergency loans from SBA, which is good, but you know, it still is very challenging to get those loans. We're still hearing that a lot of people aren't getting them as well. The needle's moving in a positive direction, but it's still a very challenging situation out there for businesses. And let's just say it's become very obvious that it's a lot more difficult to get those loans than was thought when they were all first released, you know, back 4 or 5 weeks ago. So businesses are having to grapple with that and having to decide, you know, where to go from here, whether they get funding or not. And I feel we've moved into a position where it's not just about, okay, I need some financial help to survive. It's now we're moving strategically into how am I going to conduct business if I can do business at all? And a lot of us, and I would put myself in this camp, a lot of us thought that when this first started, the stay-at-home order first started, that it was going to be a 2, maybe 3 week, you know, pause on life as we knew it. And then we would be able to kind of get back to what we would consider life as usual. And that pause was supposed to help flatten the curve and then create an environment where we could come back to life as usual. But the reality now, excuse me, seems to be that business as we knew it in 2019 is not going to come back in the year 2020, probably at all. And when you see the, you know, even the thing that David Harrison shared from the governor's perspective, if a local jurisdiction wants to make its own, you know, guidelines and loosen things up more than the state allows, they have to show that no COVID deaths over a 14-day period of time. Well, as I reflect on San Diego, I'm thinking we're probably going to hit that number sometime in 2021. You know, where we'll have a 14-day period without a single death related to COVID. It's going to be a long, long time coming. And so we're going to be bound by the state guidelines then, if that's the case. And that's a challenge. So we're hearing a lot of different things from businesses. Some who, so let's talk about restaurants. You know, we know some eateries that are gone for good, and a couple who we've heard from, but many others that we haven't even heard from yet who are not going to be able to reopen. Our nice, like, kind of upscale, nicer restaurants, what we're hearing from them is that the challenge is, you know, just everybody thinks, you know, like, oh, we'll just go to curbside pickup. Oh, we'll just go to online ordering and Uber Eats. But the experience that these restaurants have become well known for, it doesn't just translate into picking up some food on the curb. And so it's been much more difficult for them. They're not like a fast food and a comfort food type of situation. And so some of their business models are not as easily translated into just, you know, flipping a switch and saying, okay, now you can order online and pick up our food at the curb. So some of them, and David Graham hinted at this, some of them we're starting to see, they closed initially, and they're starting to see some of them start to reopen in terms of some limited scope services, because what they're aware of is when they get to the point of being able to do some limited dine-in experience, they have to have their supply chain things in place. And if they don't start doing something right now, they won't have that supply chain and inventory and things like that available to them, and they'll be, you know, even farther behind the curve. So some of them are starting to reopen limited things just so that they can at least have those kinds of things ready for more robust opening. But this is very challenging times for them to navigate and figure out how much to do, how little to do, and et cetera. We've heard from some retail businesses that are getting ready to open. I heard from a really small retail business in the village who, as she prepares to reopen and to manage the access inside her store, she's so small, she's decided that when she's able to reopen, she's going to allow one customer in her store at a time. And that's it. Really small. But it's important to her, and obviously, you know, she's got a business. She wants it to do well, and that's how she's going to approach it. But we've also heard the flip side. And again, I'm not here to name names, but I'm just sharing with you all the different feedback we're getting. We've heard from businesses that are ready to defy the orders and just, they're going to open. And if somebody calls them on it, they'll pay the fine because they don't care. It's so, you know, they're feeling so much pressure right now. And this has lasted a lot longer than people thought at the beginning. They're feeling like they're not going to survive if they don't do something. So now maybe that business was just blowing off steam that day and they're not going to do that. You know, let's hope. But overwhelmingly what we're hearing is businesses aware that they need to prepare and do things properly to protect their own staff and the customers, but they want that opportunity. Give them the opportunity, release the reins and let them get going. And so these next 2 to 3 weeks, if we don't see positive movement from the state on you know, relinquishing some of these constraints, I think it's going to get even more and more and more challenging, and we're going to have more contention. And so I don't know what that looks like exactly, but we're getting all kinds of mixed bags out there of businesses, you know. And then I've heard from some of our members, you know, some of those restaurant businesses that were already well established drive-throughs. Honestly, today compared to where they were a year ago today, their business is up. I heard from one of them, they're up 40% compared to where they were a year ago today. Now, they had established drive-through, you know, we're talking more like the fast food franchise type stuff, you know, but they're killing it because they were already good at that before, and people knew they were good at it. So people are flocking to them, and they're doing really, really well. But unfortunately, that's the limited story. And so we got all kinds of different experiences going on business-wise. And so that's kind of an update. As Carolina said, we continue to put all kinds of resources out, but we really want to help businesses think strategically about how to navigate the rest of 2020 successfully so that they are in business in 2021 when there's a vaccine and those kinds of things available, maybe it will start to look like what we were used to in 2019. Who knows? So that's where we're at as a chamber, and that's what we're experiencing and getting feedback from. And I don't know. Hopefully that's interesting.
No, thank you so much. You know, we know that you're getting, people are staying engaged, and that's a good thing. And people are continuing to reaching out to you, to us. So thank you so much, you guys. Thank you for joining. We are gonna be stopping the recording very, very shortly, but I'm gonna leave the meeting open. If you're gonna say hi or if you have any questions, just so we can mingle a little bit more, maybe a couple of minutes. But thank you so much for joining, and happy Mother's Days to all the moms out there. Get takeout and support our local businesses. I've heard of an amazing ice cream cake from Handles, I think. So go to our Instagram, go to our social, and support local this Sunday. Thank you so much, and we'll be back again next month.
Thanks, Carolina.